Hi, my name is Will Albanese. I am a clinical pharmacist and I'm the managing director here at Aspira. I'm here with my friend and confidant, Chris David. He is our marketing director for Aspira as well. And we're both between two patients right now. Just got done seeing some patients. And we were talking about blood pressure, which is ironic that you cracked the, both cracking Red Bulls. Big fans, hashtag not a sponsor.
It's great product placement, though.
Yeah.
And if Red Bull wants to sponsor, though, I mean,
we're definitely open to marketing
open
opportunities.
to it.
Yep. Yeah.
Okay.
I'm trying to think of other soft drinks I drink, and there really aren't. It's Red Bull.
None of them are really as good as Red Bull.
Yeah, but you know, we're always drinking it, and it's just funny that we're always on the go. We're always running around, so we always need that boost. But then you think about, we talked about the health consequences of, drinking a lot of Red Bull. And we're both like, "Ooh, I'm lit, I'm flushed," that kind of stuff. So we got into blood pressure, right?
Yeah.
It was interesting.
And I'm kind of concerned about my blood pressure. And also, you get a lot of questions about blood pressure. Is my blood pressure bad? What does it mean? And what can I do about it, kind of a thing?
Yeah, it comes up a lot. One of the biggest things that we actually get is a lot of patients will come into our walk-in clinic and they haven't seen a doctor in a really long time. So if you haven't seen a doctor, you don't know your blood pressure is elevated. You're walking around, it's the silent killer is what it's known as, because you don't check it routinely and you don't have any signs or symptoms. I mean, you're bleeding, but, or you have, a broken bone, you feel the pain. There's no pain associated with high blood pressure, or hypertension is the clinical name. Well,
what about like heart palpitations though? If you have heart palpitations, you're pretty certain you've got high blood pressure, right?
You got to cut back on the Red Bull.
But is that a sign of high blood pressure?
It could be. There's a lot of things that get baked into the cake, and blood pressure is this big encompassing thing. It plays in with a lot of organs in your body. I mean, it's the lifeblood of your body. I guess pun intended. But so it's really important to monitor your blood pressure. So we do get a lot of these patients that come in the clinic, they have high blood pressure, they don't know it. And one of the place where we started at was like, what do you do for these patients? Our doctors ask us all the time, where do we start? How do I treat it?
Right.
They're like, what's the best course of action? Because there's a lot of nuances to blood pressure. So, we talked about it'd be fun to talk about this kind of a thing and go over it a little bit. But yeah, I guess for starters, probably some definitions, are good to understand. You have two numbers in your blood pressure.
Well, why don't we actually take some blood pressure and then we can kind of explain my numbers as they stand.
Oh, we don't want to know your number. No, I know. Yeah, let's check it out. Let's do it.
There's like diastolic. Yeah, it's very technical.
So for starters, the one thing that we always want to do is we always want to have, when you're taking blood pressure, you always want your feet flat on the floor.
Got it.
So good patients, they're sitting in a chair. You don't want them standing up because it elevates your blood pressure. When you're sitting with your feet flat on the floor, it allows your blood to pool into the veins in your legs, which is where a lot of your blood is actually kept in reserve. So most of your blood, goes down to the bottom of your legs, and then you use your skeletal muscles to push it back up.
What about when you're lying down? Like
when you're lying down, you're kind of more equal. There's an equilibrium.
So it's really a gravity thing that we're talking about.
Yeah, it's a lot of stuff baked into it.
All right.
I'll leave it at that. Yeah.
I'll take us down the tangent if you let me.
Yeah, no, listen, I would love to talk all these tangents. What do we have? We're trying to fit this inside of 6 hours, right?
Oh yeah, we've got plenty of time. We got nowhere to be.
Yeah, distill blood pressure.
How many Red Bulls you got left?
Good question. But yeah, so the couple of cardinal things that you do when you take blood pressure is you always want to be sitting down. You always want to have your feet flat on the floor. And you kind of want to be in a sitting position for a couple of minutes. So you've been sitting here for about 2 minutes or so. And so you're in a good spot. Your arm is always kind of like at your side. I love it when someone comes in and says, all right, I'm ready to have my blood pressure taken. You're like, no, it's not going to, because the blood runs, like gravity, runs out of your arm again. So you kind of want it ideally at the heart level or just at the side more realistically.
Okay.
And then we put the cuff on, the blood pressure cuff, my sphygmo manometer, and my stethoscope, which allows me to hear the heart sounds as they go in and out of the cuff. So
I'm actually getting a little bit nervous right now. I don't know if it's the camera, the Red Bull, or honestly, I hate getting my blood pressure taken. I'm gonna try really hard to kind of like find my zen.
Oh, you'll be
I feel like mind over matter, I can do that, but I've never really gotten 2 readings in a row to confirm.
Oh, really?
But here we go.
Yeah, let's give it a whirl. So, Chris has got white coat syndrome right now. Very common, very, very common. Not,
You got a prescription for that?
Right. See the doctor more often, work on your fears. We do immersion therapy. It's like throwing you in a vat of snakes kind of deal.
What?
Yeah, we'll just take your blood pressure 15 times today and then you'll be good to go.
Oh, we definitely need to market that. Why isn't that on the website?
What's that?
The vat of snakes.
Hold on one second. Say that again.
Let's just get this over with.
We'll get the vat of snakes going. So anyway, I'm going to place my stethoscope on his artery. A lot of people have at-home kits, and they're great for just surveying blood pressure when you just want to get a quick and dirty reading. You're not like a typical, you don't have any chronic conditions, or you just want to survey.
How much are those?
Oh, they run anywhere from like 20 to 30, 20 to 80, I would say, on the higher end.
No way. So I can take my blood pressure for 20 to 30 bucks?
Yeah, exactly. Home? Over and over again.
I just love how I can feel. Thanks for that. I love how I can feel the blood just pumping. It's taken so long.
Try to cut off all the circulation in your arm.
You know, it typically doesn't take this long, Will. I think you're doing this on purpose.
So, no, I am not. But my friend Chris here does have a little bit of white coat syndrome because you're about 138 over 88. So,
great.
Little high, 138 your systolic, 88 is your diastolic. The difference is the systolic is the pressure when your heart is beating, and the diastolic is the pressure when your heart is resting. So systolic, diastolic.
So
systolic.
in between pumps is the lower number or the higher number?
In between pumps is the lower number.
So the heart's constantly going. It takes a little tiny break there in the middle just to get a super quick siesta, and then it just goes right back into action.
Yeah, I wish I had a number. I guess I'd have to think about it, but I know those numbers on like how many times your heart beats in a lifetime. It's just monumental how persistent that organ is. And that's why cardiac tissue is its own type of tissue. It's very specific. It repeats over and over again. It's very, it's long lasting and keeps you going, but it's very strong muscle and it's very resilient, millions of times in a lifetime.
I don't want to get off on a tangent, but one thing I thought was super cool is looking at a heart cell under a microscope, and it like kind of pumps or fluctuates what have you. I don't know if that's true or not, but that's a memory that I have from my childhood.
Like a science class or something,
Yeah.
little Einstein. Right?
Yeah, and I was like, oh, that's cool. Look at you got the white blood cell, you got the red blood cell, and then you got this magnificent heart cell that's like always still going. He's a lone soldier out there just pumping away.
Yeah, it's kind of, I think what draws us to science is when we see it in action. You know what I mean? Like, you like going out in the pond and exploring different animals and wildlife. So it's kind of neat you get to see some cardiac tissue under a microscope.
Well, let's talk more about my numbers, because you said it was kind of high, 138 over 88.
So a little bit nervous. The one number that most people will gravitate towards the lower number first, because what you say is your heart should be resting when it's not pumping. So in other words, if you're still very high on the lower number, that diastolic number, the bottom number,
Yeah.
that's the one that you generally look at first and you try to control the most because you want that to be lower.
Are both numbers?
Didn't even think about it. Yeah, we're pumping ourselves full of amphetamines here. Methylxanthines and...
Methylxanthines?
Methylxanthines, caffeine is a methylxanthine. So it activates your autonomic nervous system and it drives your sympathetic response. So let's dumb that down and just say,
Yeah, please.
It gets you jacked up.
All right.
Yeah.
Well,
Gets you ready for the football game, the podcast, whatever whatever you got to do. Caffeine gets you going, or just getting out of bed in the morning. We all use caffeine, right?
Yeah.
Because it activates. What it does is it activates your sympathetic responses, and it just drives that fight or flight response. When we talk about autonomic nervous system, autonomic meaning it's automated and it's controlling a lot of functions in your body. So, fight or flight is going to be, you see a bear in the woods, you need blood pressure, you need blood to go to your skeletal muscles because you need to flight. You need to get out of there.
So caffeine, what does it do? Like it constricts my blood vessels so that like more nutrients or whatever gets to my brain faster?
You're raising your blood pressure so that you can get more blood to those organs. Like, so think about it. When you're running, say you go for a run, right? The biggest problem is your muscles start to get tired because they're not getting enough blood flowing. And blood is really a surrogate for oxygen. You need oxygen to go to your muscles so that you can pump the muscle. So you're increasing blood pressure to increase blood flow to increase oxygen. Does that make sense?
It does. So on the other hand, what if I took blood pressure medicine? Would that make me tired?
Well, yeah, it does. So a lot of people will say, like, I'm tired, I'm lightheaded, I don't feel good. And that's all related to the fact that you're lowering your blood pressure, which is, you know, the exact opposite of what caffeine's going to do, which is kind of raise your blood pressure.
So if you took blood pressure medicine and then drank like 10 or whatever, would it just completely like level it out? Would there be no effect from the caffeine?
This is, yeah, I mean, like, nah, it's...
If that's the way it works.
I think that's a convoluted way of thinking about it, but
that's what I'm good at.
I mean, no, I think that you couldn't supplement your. I just like how you casually sip the Red Bull. You just like, tell me more about this delicious beverage I'm enjoying.
Well, let's talk more about those numbers though. So what's like a good number versus a bad number? And I mean, I like to think that I'm pretty healthy. You know, I went for a run the other night, and but I don't go running that much. I don't work out nearly as much as I used to. I only got about 5 or 6 hours of sleep last night because I was watching the show and I just got into it, and then like 1:30 rolls around. And
Chris, I mean, I love you to death, but you know, you strike me as a guy. I just envision you saying like, I don't work out that much, and you're just like saying, you know, I try, but
it's all the stress and hanging out with kids and having to pick them up constantly.
Well, you're doing the best thing you can, which is, you know, you're working out, which is going to help lower your blood pressure by keeping you, you know, we say diet and exercise. Those are the things that lower your blood pressure. They're the ones that are proven over and over again. So that's always where we start at. But your numbers, where you want to be is you want to be at 120 over 80.
Right.
That is about the gold standard. That being said, you know, it can go as low, it can be anywhere between the top number, systolic, can be anywhere between 120 and 90. And the bottom number can really be anywhere between like 80 and 60. So they fluctuate a little. Everyone's different. A lot of people say, hey, you know, I'm normally a little low on the blood pressure, and that's normal for them. It really is you know, it's a byproduct of their own body and their responses to their environment.
Well, so certain people, yeah, they're predisposed to having higher blood pressure, and that's just okay for their body, or is it like no matter what, you should be trying to keep your blood pressure at that gold standard of 80 over 120?
No, you don't have to. But when you do get too low, we do start to worry, because what happens is you have what's called rebound tachycardia. Yeah, big word.
Sounds pretty serious.
Love big words.
You're gonna have to dumb that down for me.
It's not. So good. It's a good way to start into the next part, which is kind of talking about. So if your blood pressure goes too low, it means you're not getting enough oxygen to your tissues, like we talked about, because you're not having enough pressure driving the blood through your arteries and veins. So what happens is, to compensate for that, your brain, which is also not getting enough oxygen and realizes that, goes, hey, we got to get some blood flowing. So it starts increasing your heart rate. So that is the rebound part, and the tachycardia is another word for higher heart rate. So tachy meaning fast and cardia meaning cardiac. So faster heart rate. So the rebound is a response to the low blood pressure. Happens all the time in the hospital. Patients that are really sick will have basically they'll basically have a lot of vasodilation. So where all their blood vessels are dilated. Now if you dilate, if you have the same amount of pressure going through a pipe and the pipe gets bigger, the pressure goes down because there's more room for, you know.
Right.
Same way. So blood vessels are the same way. When you have blood pressure going through your arteries and it drops, the pressure drops, basically, I lost where I was going with that one. But basically you need to get more blood here. You gotta get more blood here.
Drink some more Red Bull.
Yeah, but it's when it's low. Oh, it's low. You try to get it back up. One of the main
gold standard. Yeah.
Yeah, you want to get it back up because you want to get what's called perfusion of tissue, and it happens all the time in the hospital. I would say probably half the patients in an intensive care unit are on medicines called pressors. So norepinephrine, epinephrine, dobutamine.
Like adrenaline is what norepinephrine, right?
Exactly, yeah.
Got it.
100%, yeah. Layman adrenaline, or like what your body produces, is kind of like an 80-20 mix of norepinephrine and epinephrine.
Can I get a pill that's adrenaline? Because I feel like sometimes I just need a really good jolt, and just the Red Bull doesn't do it. I probably shouldn't do that for my... What about marathon runners, though? Like, if their blood pressure's too low, are they still suffering from the same issue? Or are they just so healthy that their body has no problem with that lower blood pressure?
No, that's so that goes back to the tissue perfusion. You know, everyone's different. You know, you asked, hey, can some people have lower blood pressure and higher blood pressure? Marathon runners can definitely have lower blood pressure, and the reason why is, and lower heart rates. Their heart doesn't have to work as hard to pump blood because their muscles are so efficient. Like they have strong muscles, they don't need a lot of perfusion when they're resting. They need perfusion when they're running, but their muscles are very efficient and they can operate with lower, basically, blood pressures and volumes.
What about if I have high blood pressure? Like, I love to drink caffeine and then go to the gym. I like to get jazzed up, and like that's my one time, like a month to get to the gym. I'm gonna make it a good one.
You eat an entire tub of pre-workout?
Yeah, just so much pre-workout. Is that bad for me, or should I probably not do that?
I would worry about people. Well, I would worry about people with risk factors. You know, if you have high blood pressure that's being treated, you're kind of playing with fire if you try to raise your blood pressure. You know. Okay. But if you're young and healthy, like you and I, you know, just superstar athletes, you know, I run about once a month.
Looking great, bro. I can tell.
But yeah, no, you could do that, and I don't think there's anything wrong with that. One of the first questions we ask as pharmacists is, do you have high blood pressure? If you don't, I say, here, take some Sudafed. Yeah, you get that transient increase in blood pressure, but your body can either compensate for it, or it's so small, or it doesn't have any deleterious effects in small portions.
Okay.
Everything in moderation, right?
Right.
Can I get another Red Bull?
But meth. Yeah, go grab me one.
Can I get another Red Bull? No. Yeah, this is like throwback to college studying. Like we'll just have a counter full of like empty cans.
I love how they make like the big like 24 ounces now.
I think that's something we should talk about. I mean, I don't know if that is way over. This thing has hashtag not a sponsor. The sugar is probably the worst part, but the B12, there's a lot of B12 in there, and B6.
There's only 80%. Oh, B6.
We're gonna have to talk about that later. Niacin. That's another one. That's what makes you feel flushed. I used to love the commercials for Enzyte late at night. There was like a male.
Enzyte?
Remember male enhancement? Yeah. Well, it was a lot of niacin, and niacin's side effect is that it makes you flush.
Right.
So you're like, oh, I'm definitely feeling better, and all of a sudden you're not. So.
And it's just all in your head because niacin makes you flush.
Exactly. It's just a side effect of a medication.
It's got to be working. I can feel it.
Exactly. Try some Spanish fly.
Not to talk over you, but I don't know how much time we've got.
I do have another patient coming up.
Between
two patients.
I had compression socks. Okay, so are compression socks good for high blood pressure or low blood pressure? And what does it do?
Oh, I love compression socks.
Yeah.
I'm a big fan of compression socks. Well, I had a physical therapist tell me this, and I love it, and I still quote it to this day. Compression socks are like your second heart. I mean, if you think about it, your blood
is that good for you?
Yeah, I mean,
really?
Even as a young person. Well, like, think about it. After a long run or a workout, you get a muscle rub, and you're trying to release lactic acid and all the, stuff
which makes you sore, right?
Yeah, you're kind of like trying to like treat that kind of like the pain and get things going so your muscles get back to normal. Anytime you're pumping blood, you're removing those waste products because your muscles chew up, energy sources, and then they spit out lactic acid. Okay. Lactic acid hurts. It's an acid. That's why your muscles burn. So it's important if you pump the blood, you're getting that stuff out of your body. So the great thing about compression socks, I wear them all the time. The day after I work out or go on a long run, I wear my compression socks because it helps put the blood from my legs that pooled into my legs and pumps them back up. Your body was designed with check valves in all your veins in your legs. So that what happens is when you squeeze your calves and your thighs and your quads, the blood gets pumped up through the veins, and then it checks it, and it holds it there, and it keeps pushing it up. Because if you think about it, that blood's got to go against gravity back up to your heart.
Right.
So compression socks are that second heart that's pumping that blood back up to your heart.
So
Love compression socks.
That's a great, yeah, all right. So maybe I need to wear the compression socks that my
The old man socks.
yeah, my mother-in-law bought me. I'm like, oh great, I'm 36 years old, getting some compression socks. Cool.
And I'll plug our favorite pharmacy down the road that has a huge variety of compression socks, and they're all really good. They're top quality. Cape Pharmacy, we refer everyone to them because they have all the stuff you need. They have it right there, and they've got great people that'll help you out. But you can also get them online, or you can look for them anywhere. But give them a try. I mean, like, I always feel a lot better when I'm wearing them, especially if you're standing all day and you just want to pump that blood back. You know, you're getting more blood in circulation, which is giving you more energy because you're carrying more oxygen and removing more waste and stuff. So
that's one great thing that you can do about your blood pressure and lactic acid. But how long does it take to get back to, you know, to make a significant change a positive change in your blood pressure? Diet, food, exercise, like how often do I need to exercise, and do I have to dramatically change my diet? Like, how much impact do I really need to, how much effort do I really need to put in to get the minimum amount of impact here?
all the effort.
All the effort?
You need to run 8 days a week. No.
I'm just gonna have high blood pressure then.
Yeah, a lot of people have resolved that. They're just like, you know what, I'm done. Well, one thing I should say too is blood pressure is important because when it's high, what it's doing is it's pounding on all your vital organs. The biggest ones affected are your brain, your kidneys, your heart. You know, when you have high blood pressure, you know, think about it this way. Your aorta comes out of your heart. And if you have high blood pressure, meaning high pressures in all your vessels, including your aorta, your heart has to pump harder to get that blood going through your system. So your heart's working harder. I mean, just like any muscle or any motor, if you work harder, you're going to burn out quicker. So I know I dumbed that down a lot, but you know, that is very true. Same thing happens with the kidneys. When the pressure is high, your kidneys are filtering your blood. So if you're pounding on something, think of a screen door. If you start punching a screen door, eventually you're going to go right through the screen.
So this is way more than just heart health. This goes into like the whole body health.
Oh yeah, absolutely. I mean, blood pressure touches every organ in your body. And we talk about, you know, if you have really high blood pressure, what we would call a hypertensive urgency or a hypertensive emergency, you have those numbers where you're like 180 over 100, you know, 105 is that bottom number there. And when you're that high and when you have something called end organ dysfunction, meaning you have like a headache, that's because that pressure is just pounding on your brain. Or if you have chest pain, it's because that pressure is, you know, your heart is working so hard, it's exhausted. So those are actually things that warrant a hospital visit and may even necessitate an overnight stay to bring that blood pressure down, stabilize you, and make sure you're okay to go out.
So I'm 12 points away from that right now. So that's awesome. I got to get some better life insurance.
Transient. Let's see how you do without the Red Bull, hashtag not a sponsor, and then we'll go from there.
All right. Well, I think that might be a good time to wrap up.
I enjoyed our little conversation. I think I have to go see my next patient, and then we can talk about something next time I have some time in between two patients. How's that sound?
That sounds great. I appreciate your time. Thanks for answering all my incessant questions and taking my blood pressure and telling me what it means.
Until next time, my friend.
Until next time.